Good morning, friends. Today we discuss about the topic starvation, fasting, and its significance. Starvation is a severe deficiency in caloric energy intake below the level needed to maintain an organism's life. It is the most extreme form of malnutrition. In humans, prolonged starvation can cause permanent organ damage and eventually death. Symptoms: feeling weak or tired, lack of energy, loss of consciousness during a fast. As no food is eaten, the body has to adapt and learn to store energy. The human body stores energy in several places for use when food is scarce. The first stored energy used during a fast is in the form of glycogen, which is broken down to form glucose. What is starvation? Starvation is an extreme case of undernutrition in which there is deprivation of food or the intake of energy and nutrients in far below the critical level. Prolonged and extreme starvation is fatal. It may cause permanent and irreparable damages to tissue and vital organs and ultimate death. Complete deprivation of food in all probability causes chemical alteration in the body. Often it produces a poisonous effect due to the formation and accumulation of ketone bodies. In case of slow starvation, the vitality of the tissue may be reduced and they become more liable to tuberculosis and other diseases. Starvation usually causes several nutrient deficiency diseases such as Kwashiorkor, marasmus, rickets, Burberry, pellagra, diarrhea, etc. In starving persons, there will be considerable loss of muscle mass and stored fat, since stored fat and muscle glycogen are mobilized as energy sources. Starving individuals are characterized by extreme loss of weight and emaciated appearance, pale and dry skin with rashes, extremely leathery fatigue and exhaustion, etc. Sometimes partial starvation or fasting is used as a method of treatment in some diseases that are associated with excessive eating, obesity, etc. Fasting. Fasting is the willful abstention from food and drink. Fasting practiced for thousands of years in the past as a religious and spiritual custom and also as a cure for several diseases and disorders. Is now on the release for a comeback. Total suspension of food and drink produce two imminent results. First one, body becomes thinner and lighter since it draws up upon its stored nourishment. Second one, body temperature gradually falls low. Body weight decreases with fasting time. This decreases is not linear. The body of an adult human being has remarkable capacity to survive without food for long periods. How does the body adjust itself to prolonged fasting or starving is most fully understood. However, studies on the physiological and biochemical adaptations for starvation has revealed that the ability of the body to mobilize its internal resources is very vital for survival in the absence of food intake. Next, physiological changes during fasting. The major physiological changes taking place in the body in response to prolonged fasting and starvation are the following. First one, drop in the level of fuel molecules in blood. Progressive decrease in basal metabolic rate, that is BMR. Mobilization of reserve nutrients with a drastic drop in their store. Synthesis of glucose in liver from glycogenic amino acids, mainly alanine. Synthesis of alanine from pyruvic acid. Steps to control protein loss. Formation and accumulation of ketone bodies. Changes in the role of renal cortex. And last, hyposecretion of insulin and hypersecretion of glucagon. Drop in the level of fuel molecules and remedial steps. The immediate effect of fasting include drop in level of all nutrients and fuel molecules in the blood, and the considerable decrease in the store of reserve nutrients. Body needs fuel molecule as a source of energy for vital functions. The principal fuel molecule is glucose. Its most critical uses is the brain. For brain, it is an essential as oxygen. So rapid and prolonged drop in the blood sugar level may very severely affect brain functions. It may cause behavioral changes, confusion, coma, damages to brain cells, and ultimate death of the person. The main glucose reserve of the body is the liver glycogen. Some amount of liver glycogen is not ordinarily available, since liver will conserve it to meet stressful emergencies. Fall in blood glucose level will be followed by the mobilization of glycogen from liver, fat from adipose tissue, and protein from skeletal muscles. The glycogen store of liver may be converted to glucose by glycogenesis. Stored fat, that is triglycerides, will be broken down to free fatty acids, which can supply energy to tissue other than nervous tissues. Some of the amino acids are glycogenic, and they will be utilized in liver for the synthesis of glucose. Of all the amino acids, alanine is the principal substrate for the synthesis of glucose in liver. The conversion of alanine to glucose occurs in liver in a cycle of reactions called alanine cycle, which is somewhat similar to the Cori cycle, in which muscle lactate is converted to liver glucose. Next, fall in BMR. As fasting or starvation continues, several factors come to the acid of the person. Accordingly, as fasting or starvation continues, several factors come to the aid of the person. Accordingly, his basal metabolic rate slows down, and the body's need for calories get further reduced. A starving person engages only in minimal spontaneous activities and become more sparing in energy expenditure. So, less energy, more efficiently and more judiciously. Steps to control protein loss. A starving body resorts to strong measures to control protein loss and thereby conserve its integrity. The skeletal muscle considerably reduces the rate of protein breakdown and the release of the alanine. As a result, the synthesis of glucose in liver becomes minimal. It has been observed that during the 4th or 5th week of fasting or starvation, liver and kidney together produce only the least minimum of glucose, and virtually all this glucose goes to brain. Next, accumulation of ketone bodies. During starving, the supply of glucose to brain progressively declines. This deficit would be made up by the supply of a substitute source of energy, mainly ketone bodies found from fatty tissue. They include acetoacetic acid and its derivatives, acetone and beta-hydroxybutyrate. These substances yield energy on oxidation, and the brain will adapt itself to use them as energy substrates in place of glucose. Brain has the enzymatic machinery to utilize ketone bodies as a substitute source of energy. The metabolism of fatty acid does not ordinarily produce ketones. However, during starvation, fatty acids are released from fat depots and are oxidized in liver, forming acetoacetic acid. Blood transports this acetoacetic acid to other tissues to provide them energy. The accumulation of ketones in blood during starvation and also in persons on a high-fat diet is often called ketosis. Ketosis during fasting evidently signals the response of the body to the depletion of the supply of glucose. Change in the role of renal cortex. There is a striking changes in the role of renal cortex during fasting or starvation. Normally, renal cortex is a minor partner of liver in glucose synthesis, but during starvation, it becomes a major producer of glucose and it synthesizes more glucose from amino acids than synthesized by liver. This shift is due to a change in the acid-base balance in the blood caused by the accumulation of ketone bodies. Next, hormonal response to starvation or fasting. The mechanisms which bring about adaptive changes during fasting and starvation are not fully understood. Certainly, hormones do play an important role. During prolonged starvation, insulin stands at a much lower level and glucagon at higher level than the normal. Insulin and glucagon are antagonistic in action. Insulin in optimal level stimulates the synthesis of fat and inhibits fat breakdown, promotes the uptake of glucose and amino acids by muscle cells, and last one, inhibits the synthesis of glucose in liver. So, its hypersecretion minimizes these processes. An alteration in the balance between insulin and glucagon during starvation may promote the activity of liver for glucose synthesis and fat metabolism. Next, significance of fasting. First one, fasting is a self-imposed control on the excessive desire, temptation or urge for overeating. Fasting is the best way of coping with emergency situations in which food supplies are very much limited. Fasting is a voluntary adaptation which enables the body to adjust itself to a lack or shortage of food. Fasting and dieting are partially useful in weight reduction in obese person. Fasting is medically important in controlling or curing several hard to treat disorders and diseases ranging from arthritis to migraine and also from the skin disorders to allergies. Clinical studies in Scandinavian countries have revealed that fasting is very effective treatment for rheumatism, especially if the patients follow up with vegetarian diets. That is, the clinical study in Scandinavian countries revealed that fasting is very effective treatment for rheumatism, especially if the patient follow up with a vegetarian diet. Other studies have shown that fasting is successful in lowering blood pressure and treating chronic migraine and arthritis. Neurological studies have found that fasting is considerably lower the level of stress hormones and at the same time will raise the level of serotonin. On the whole, it appears that fasting works like a reset button for the self-regulating mechanism of the body. The metabolic switching taking place when the body starts on its own reserve has a wonderful healing effect on several diseases. There is no way of achieving permanent weight reduction without reducing the intake of calories to less than the actual expenditure. So the greater such a difference between the intake and expenditure of caloric energy, the faster would be the loss of weight. From a purely biochemical standpoint, the most effective way of reducing body weight is complete fasting, in which stored fat is the major source of energy for brain and other tissue. However, total fasting for a long period of time can be dangerous. So we must always refrain from long fasting and must avoid too much exercise during fasting, especially during the initial phase. Occasional or practical fasting, in which a person subsists only on liquid food, such as the juices of fruits and vegetables, is considered to be useful for cleaning the body from toxins and dead and damaged tissue, and also for giving rest to digestive system. The researchers found that fasting dramatically improves stem cells' ability to regenerate in both aged and young mice. In fasting mice, cells begin breaking down fatty acids instead of glucose, a change that stimulates the stem cells to become more regenerative. When we begin to fast, the body initially breaks down a number of immune fighting white blood cells. Okay, thank you.